Following portion of Daytime Tri-Cities is sponsored by ETSU Health. Once again, it is time to meet your provider with ETSU Health, and today we're talking with Dr. Shambhavi Chandraiah. How are you doing, doctor?
I'm doing great, thank you.
Let's talk about your journey to come to ETSU. How did you tell us about your career? Tell us about your history.
Okay, I've got a rather interesting history, so I will
Yes.
give you that. Born in India, grew up in Canada, have been in the U.S. for about more than 30 years, different academic institutions, and have been at ETSU since 2014.
Right. Do you like the teaching side of things?
I absolutely do. And in fact, that's what my career essentially has been in all the different places I've been.
Right.
It's always been in the academic side. And the most wonderful thing about that is when you train medical students and residents and they grow and move on and become successful, and then hopefully some of them will stay in the teaching field as well to teach our future generations. That's the best thing I love about
To
it.
see your legacy grow.
Yes, absolutely.
That's very, very fulfilling.
It is.
It is. Your specialty is adult psychiatry.
It is.
What brought you down that path?
Well, actually, my first rotation, and this was in Canada, was with a psychiatry rotation with an attending. And that attending was just amazing. Supervisor, clearly enjoyed his job, had a well-balanced personal and work-life balance. And I thought, that's what I want to do. And I've never regretted it, absolutely enjoyed it.
How have things changed in psychiatry? Has things changed dramatically? I mean, I've talked to other doctors in other fields, and they say from the time they began till now, things have changed dramatically from the way they practice. Has things done the same for you in psychiatry?
Yes, certain things have changed. So during my training days, we had a lot more focus on psychotherapy being a core part of our training, along with medication management as a comprehensive treatment plan for every patient. Over time, there has been, and sometimes the pendulum does swing. So over time, the pendulum swang to where it was much more focused on medication. Part of that was we had imaging and other ways to probe the brain. So there was a lot more focus on the biological aspects than the therapy aspects. We are to some degree realizing that, we've kind of swung too far the other way, and we're trying to bring back and say, to really best treat the patient, you have to be able to do both.
Right.
So we make sure that in our training program that our residents get training in different styles of therapy, but also the different kinds of medication management to help the different psychiatric disorders.
Let's step away from your profession for a moment. Talk about your personal life. Tell us about your family. Tell us about what you do for fun.
Well, I have 3 children,
Okay.
grown, successful in
Very
their
good.
individual careers in different parts of the country, one of whom is a physician,
Okay.
which is always nice. And what I enjoy, and I have to tell you, I didn't do this before I came here.
Okay.
Because I didn't realize how beautiful East Tennessee is. I came here more because the job and the need here and what I was interested best fit that. But once I got here and got into hiking, just discovered how gorgeous East Tennessee is. So
Yes.
I hike most weekends. I belong to a hiking club.
Right.
And part of what we do, because I'm a program director,
Right.
so I get to every year interview a whole bunch of candidates, and we just had the match, and I get to talk about how wonderful this area of the country is. So we do have leisure along with all the learning that we do in the program.
And as practicing psychiatry, to have that balance in your life is so very, very vitally important.
It's very much so, and it's
Yes.
become an important area for us in particular because we know there's a lot of stress in being a physician in any field.
Right.
And psychiatry, particularly where it touches on the mind, I think has a lot of important stressors that can happen both for the patient, obviously, and also for providers that are working in the field, depending on what all they do within the field. So it's really important that we make sure we teach as well as try to practice
Right.
a good balance of work and life, whether that's your healthy body, healthy mind, exercise, yoga, whatever, good diet, good, whatever all you like to do. That's equally important to being a great physician, a great psychiatrist.
What is, and this may sound like a trite question, but what does a normal day look like for you?
Okay. Because I'm the program director, a lot of what I do really deals with the educational and administrative aspects. We have 7 residents per year, so that's about 28 residents over the course of 4 years. So I do a lot of that. Our training has to do with, in our first year, not just psychiatry, but we also learn primary care and neurology as well. So we have to do that, and then we learn inpatient psychiatry, then outpatient psychiatry, and then sort of put it all together, including with the therapy training, to be the full rounded psychiatrist before people go off to do, you know, whatever type of job that they want to do. So a lot of that, that is what I do. But what I love doing is supervising clinics, where we have residents and also medical students. And one of the wonderful things is when we have a medical student and they start getting very excited about psychiatry and many times decide that's what they want to go into. So I feel like we've kind of lit the light over there, and that's always rewarding as well. I also have my own clinic where I see patients directly as well. I do teaching, lectures and presentations and things like that as well.
All right. Keeping that balance in your personal life and in your professional life.
Yes, as I said, the hiking has been a wonderful thing, but I also travel internationally and other things and do a lot of other, you know, physical kinds of activities.
Well, thank you for taking some time out with us today.
Absolutely, enjoyed it.
Dr. Shambhavi Chandraiah, this week's Meet Your Provider with ETSU Health. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.